Good evening, everyone. I am Dr. Naresh, and I welcome you all to this interesting session that is organized by Hetero regarding creating awareness about CNS tumors, or which we call in layman's term as brain tumors. This is in accordance with the fact that May is being observed as World Brain Tumor Month. So, if we talk about CNS cancer or CNS tumors, we generally tend to have approximately 25,000 people who are diagnosed in a year with primary CNS cancer, which represents 1.4% of all the different type of cancers. So CNS tumors are relatively uncommon, but they have a variety of subtypes, and they say that there are more than 130 different types of tumors that can arise in the brain. And if you see the prevalence, we have almost 104,000 people who at any point of time would be living with this disease. The point to note here is that even though CNS tumors are relatively uncommon malignancies, they are known for their poorer outcomes, and they are associated with significant morbidity. If you see the scenario in India, the total number of new cases diagnosed in a year is somewhere about 32,000, and the mortality due to this disease is around 26,500 in a year. Now, if we see the different type of brain tumors, it can be categorized, or they are basically classified depending upon their cell of origin. So you have the gliomas, which arise from the supporting cells or the glial cells. Then you have meningiomas, which arises from the meninges, which is nothing but a thin film of tissue that surrounds the brain and spinal cord. You have tumors that arise from the neurohormonal complexes in the brain, like the pituitary adenomas. You have the schwannomas. You have medulloblastomas. And then you also have malignancies that arise from the neuroectodermal tissues, which are broadly categorized as PNET or primitive neuroectodermal tumors. Malignancy can also arise from the germ cells situated in the brain parenchyma, leading to germ cell tumors. And then you also have craniopharyngiomas. Now, if we see the symptoms that happen when a person has a tumor developing in his brain, what we need to understand is that the skull is an enclosed structure. So any tumor that grows inside the cranium would cause increase in the pressure in the cranium, which we call it as intracranial pressure. And it is this pressure that gives rise to multiple symptoms. One of the most common symptoms with which brain malignancies or brain tumors present is headache. Sometimes when the tumor compresses or involves the cortical structures, they may give rise to seizures. One of the most common manifestation, which is often neglected, is nausea and vomiting, which is generally attributed to GI causes. Apart from localizing symptoms, tumors in the brain can affect the global functioning of an individual, which may affect his ability to think, remember, cognition. It can also present non-specifically with generalized fatigue. And then you can have localized features like difficulty in hearing, difficulty in vision, change in voice. Apart from that, you can have features of cortical structures involvement or the tract involvement, which can present as difficulty in balance, weakness in legs and hands, which in common terms we called as paralysis. We have vision problems if the posterior part of the brain is involved. And then there can be certain emotional or behavioral changes in the form of change in mood or behavior. Now, what are the risk factors for development of brain cancers? Now, brain cancer is one disease wherein the number of risk factors are not clearly defined as we have in many different cancers. So we can discuss some of them. One is age. So they say generally brain cancer occurs in the extremes of age. So you have certain primary CNS tumors which are seen in the pediatric population. But if we talk about adults, the median age of diagnosis is somewhere between 59 to 65 years. So there is a peak which is seen in the pediatric age group and then a peak in the elderly age group. One important risk factor is inheritance of certain hereditary and genetic diseases like neurofibromatosis, Turcot syndrome. So somebody who is diagnosed with these hereditary disorders has a very high risk of developing a brain malignancy. Certain viruses like Epstein-Barr virus and cytomegaloviruses have been linked to certain type of CNS diseases like primary CNS lymphoma. The exposure to ionizing radiations is one of an important risk factor for development of brain tumors, and it is probably one of the risk factors that is proven very conclusively to be associated with an increase in the risk factor for development of CNS malignancies. A lot of evidence for ionizing radiations do come from the survivors of the atomic explosion and also the pediatric patients of acute lymphoblastic leukemia who have been treated with craniospinal irradiations. Certain racial and ethnic predisposition is also seen for brain malignancies. Exposure to certain chemicals, especially certain petrochemical products, is supposedly associated with an increase in the risk of breast cancer. And there are certain reports, though controversial, which say that the presence of a serious head injury has been shown to increase the risk of CNS malignancies. Now, what are the different tests or investigations that is generally performed when a patient presents to us with a suspected CNS malignancy? So first and foremost, every physician would do is he will take a complete medical history and do a thorough neurological examination so as to assess what neurological deficiencies the patient has, what has been its course and presentation, how rapidly or how slowly these neurological features have developed. And based on that, he would make an assessment about the possibility of a CNS tumor. And we generally advise certain basic blood tests and parameters to rule out other causes. In certain cases, the patient may be subjected to a biopsy or a stereotactic biopsy more commonly. But more common than biopsy, in majority of the centers, the characterization of the brain lesion is done by imaging, more commonly by a very good quality contrast enhanced MRI. So on this contrast enhanced MRI, if we find a space occupying lesion in the brain, nowadays MRIs are good enough to characterize the space occupying lesions in the brain and give us an idea about what is likely this brain SOL is, whether it is a benign or an infective SOL, or it is more likely to be a malignant SOL. We also have newer technologies like MRI spectrography, which are able to assess the chemical content of the brain SOL, thereby giving us a better idea about the nature of the lesion. And in many centers, data from these non-invasive imaging studies is used to establish a diagnosis and proceed directly with surgery. Apart from these tests, we do have certain advanced biomarker testing and immunohistochemistry tests that are done in certain scenarios. So stereotactic biopsy, again, this is an area of expertise of a neurosurgeon. It's a very specific and targeted biopsy wherein, with minimal invasion, a tissue diagnosis is established. This is generally preferred in cases where the information from the imaging modalities is not conclusive and we need to accurately diagnose the brain SOL, especially when we are considering it to be a case of lymphoma, wherein surgery may not be the best treatment option for the patient. Then we have the MRI scan, which I previously discussed, generally done with a contrast. So what are the different treatment modalities that we have for CNS cancers? Surgery, probably the most important treatment modality for most of the brain tumors or the CNS malignancies. Surgery can be of different kind. It can be a gross total resection, a partial resection. But the main principle behind surgery is that we resect the maximum amount of tumor that can be resected without causing significant neurological morbidity. We have chemotherapy like temozolomide, procarbazine, lomustine. But the problem with chemotherapy in CNS tumors is that with the presence of blood-brain barrier, most of the modern chemotherapeutic drugs do not have very good penetration in the central nervous system. So in majority of the cases, especially when the treatment is done with a curative intent, chemotherapy is generally combined with radiation therapy. In terms of radiation therapy, we have different techniques like EBRT, 3D CRT. We have the newer modalities like proton beam therapy. And then we have an extremely focused high dose radiation technology called as stereotactic radiosurgery or SRS. We have other treatment modalities like alternating electrical field therapy, targeted therapy, which are different types of chemotherapy, which is given in specific individuals in whom the tumor possesses a specific target. So we have rituximab, which is given for CD20 positive lymphomas. Then we have dabrafenib, trametinib, which is given in metastatic melanomas to brain. So these are the different targeted therapies that we offer for patients with CNS diseases. And then obviously rehabilitation, because these patients would be having significant morbidity. So they would require a lot of physical therapy, occupational therapy, and speech therapy. So radiation therapy basically utilizes ionizing radiation in order to cause DNA damage of the cancer cells, thereby killing them. The different techniques that are mentioned in this slide is nothing but they basically indicate advancements in the technology of radiation, because the purpose of radiation therapy is to give maximum dose to the tumor proper and minimize the dose to the normal brain parenchyma. So external beam radiation therapy is nothing but radiation that is given from outside, which you can see in this diagram. The ionizing radiations are shot towards the patient from an external device, and the accuracy with which the dose is conformed to the tumor is better with the technologies. Like the dose conformation is very high with IMRT, and it is relatively lower with 3D CRT. Apart from that, we also have newer type of radiation which uses particles of proton rather than ionizing radiations in proton beam therapy. And the extreme form of conformational radiation is stereotactic radiosurgery, in which radiation is given at an extremely high dose in a very, very, very focused area. We also have chemotherapies, which when we attempt to cure the brain cancer or brain tumor, may be given alone or in combination with radiation, which is the case in majority of the things. We have drugs like procarbazine, lomustine, vincristine, which are given generally as combination chemotherapy. So this chemotherapy can also be offered in patients who have a brain tumor recurrence, in which generally we don't treat the patient with a curative intent if he or she is not amenable to surgery. More or less, the drug remains the same. You can re-challenge with a particular agent depending upon the time of drug-free interval. Then you have this alternating electrical field therapy, of which I may not be the best person to discuss the technical details of it. Then you have targeted therapy. As I said, the brain tumor cells possesses certain targets which we identify by means of newer diagnostic methods like immunohistochemistry and other genetic testing. And then we give targeted agents towards the specific therapy. Immunotherapy is upcoming modality of treatment in many cancers. So basically, it's a therapy that engages your own immune system and activates it to fight against the cancer. So how do we prevent from developing or reduce our risk of developing brain tumor or brain cancers? Now, a disclaimer is that there is no hard and proven prevention methods by which you can significantly reduce your risk of developing brain cancer, because the risk factors itself are not very well defined when it comes to primary CNS malignancies. But yes, avoiding exposure to pesticides and petrochemical products does decreases an individual's chances of developing not only brain malignancies, but other diseases. Similarly, avoiding unnecessary exposure to carcinogenic chemicals would certainly reduce an individual's risk of developing a malignancy. Avoiding smoking, apart from having a effect on reducing the incidence of lung cancer, has so many other health benefits. Limiting the exposure to radiation, again, it's an important preventive way in which we can reduce our incidence of developing different type of malignancies. And this especially becomes important when we treat cancer patients with radiation therapy, because the sole purpose here is to cure the disease with the minimum dose of radiation possible. Knowing well about your family medical history, assessing whether you could be having a hereditary syndrome which will predispose you to a brain tumor is important. You should know whether you have a very strong family history of brain or any other malignancies that would probably help you identify yourself as a high risk individual. And we all need to understand is that as we grow old, we all are at increased risk of developing not only brain tumors but other malignancies also. Regularly exercising and having a healthy, nutritious diet will definitely protect you against different malignancies as well as many cardiothoracic illnesses. So this was a nutshell about CNS tumors, how common they are, how they present, and what are the different treatment modalities, and what are the simple but effective steps you can take to reduce your chances of you being diagnosed with this dreaded illness. I hope I was able to communicate this in as simple words as possible to you, and I really thank you for this opportunity.